It's more important than ever now that you look after yourself. Making health and nutrition a priority during the COVID-19 pandemic must be your focus. The pandemic is surely affecting every aspect of our lives. Working from home, not being able to hit the gym, and the comfort of your couch for a prolonged period can sure make you lethargic. There isn't a cure to coronavirus as yet, but there sure are ways you can fight the battle strong. Some daily habits and dietary changes. No one knows how long these virus safety measures need to be in place. But this surely gives us the perfect time and opportunity to catch up on a healthy lifestyle. Don't stock up, but buck up. India Today's panel of experts tell you how to beat the coronavirus.
Welcome to this India Today special. There is no doubt that the coronavirus outbreak here has affected all aspects of our lives. Coronavirus has pushed us to now rethink our lifestyle. While the world is scurrying around to find a cure, it all boils down to your fitness levels. How fit are you? Is your immune fit enough to emerge from this crisis? Well, to tell us a little more and how to really boost our immunity, stay strong through this crisis here, are a bunch of experts joining us on the panel to give us a tip or two on what to do while you're at home isolation. Here are our guests joining us, Dr. Parmeshwar Arora, who is our Ayurvedic specialist, Dhyan Pandey, celebrity nutritionist there, Dr. Lavneet Batra, nutritionist herself, Dr. S. Gopal Kumar, the RMA of the Government Ayurveda College in Kerala, as well as Dr. Samarth, who is a doctor from Bengaluru practicing Ayurveda. Let's quickly go over to Dhyan Pandey joining us, who is a celebrity nutritionist who's given out a tip or two to several of those celebrities who are currently working out at home, following a certain diet and ensuring their immune system is in top condition. Doctor, do tell us, Dhyan, what is it that we've got to follow to ensure that we emerge from this crisis successfully?
The main thing is stress and panic, because what's happening is there's a lot of misinformation out there. WhatsApp is either your friend or your enemy. You need to follow WHO, like World Health Organization. I personally follow it, and I follow Mumbai BMC, because that is what you need to follow.
No, undoubtedly, basic etiquette's got to be in place. You don't have to panic. But when you have to make some lifestyle changes, if you could give us a tip or two on what to do at home. Currently, we have no choice but to stay at home. No gyms are open. Can't step out. Can't go to work. This naturally makes us quite lethargic.
Yoga, meditation is a proven Indian thing for years that should be. This is the time to practice a lot of meditation and yoga at home. Home workouts. Eating healthy. You know, our Indian cuisine is the healthiest, the way our grandparents, our great-grandparents cooked, using, you know, adrak lasun paste, using haldi, turmeric, using our Indian spices, less oil, ghee. My husband and me are home people. We don't go out that much because we work from our home, so that we are fortunate and we used to that. The changes that we made major is mainly my home workouts, because I don't get to go to the gym or to a yoga class. A lot of home time with sanitizing, cleaning, educating our staff on hygiene, on the virus. So mainly so that they keep themselves safe, they keep us safe, and they educate their families back in their villages.
Absolutely. It is a social responsibility. Let's quickly go over to Lavneet as well, who's also joining us, a nutritionist. Lavneet, quick remedy to boost your immune system. Nothing is quick. I know it is a long process to build your immunity, strengthen your body, but there are a few daily habits that we could change, isn't it?
Of course, there are few daily habits that we can change. I think this is the best time that we are at home, so best time to use home remedies and eat home-cooked fresh food. But if we are talking about certain antiviral remedies that can help us combat flus, it would be tulsi, star anise and giloy. These three things are found very often in our kitchens, and you can use it as aqueous solutions to boost your immunity.
Okay.
What you can do is take 4-5 leaves of tulsi, boil it in water and have it first thing in the morning. It's naturally antiviral. It also helps in relieving symptoms like cough and cold. Now star anise is another spice that we use in garam masalas, in biryanis, that we can make an aqueous solution out of. You take about 500 ml of water, put 3 to 4 pieces of star anise and boil it to half and have a cup maybe during the day, not very close to your main meals. And giloy is something that is also anti-fever, so it'll help you if you do have temperature. It can help naturally in bringing the temperature down. Take giloy leaves and again boil it in water.
Right, Lovneet,
but
we
again,
do
it
know
has to be in synchronization with your
absolutely. We do know that there isn't a cure as yet to coronavirus, but what tips that these doctors and experts are giving us is more to do with strengthening your immune system. Coronavirus or not, this is something that you can do to build your immunity to fight any common cold, cough, fever, virus symptoms.
Absolutely.
Unfortunately, there isn't a cure to coronavirus as yet, but maybe this is something or a chance that you can really take to ensure good health. Let's quickly go over to Parmeshwar Arora joining us, our Ayurvedic specialist.
Absolutely.
Dr. Parmeshwar, quickly a word or two on what Ayush Ministry has sent out, an advisory where they say that there isn't a cure, but yes, there are methods to strengthen your system to fight anything that you may face, not specific to coronavirus. What's your take on that? And I believe you have something in your hand to show us as well.
See, being Ayurvedic scholar, first I want to clear a fact that along with maintaining good personal hygiene, social distancing, and that everything what the doctors are saying, Ayurveda gives equal importance to the maintenance of stronger immunity for being protected from any infection, including these viruses. And our immunity is very, very essential at that particular scenario, present scenario, and for maintaining immunity, mainly our healthy diet and the good lifestyle is the main contributors. And if you talk about the healthy diet, the first thing I will recommend as an Ayurvedic scholar is the Indian gooseberry, that is the amla, because we all know that vitamin C plays an important role in building the immunity. So in spite of going for the citrus thing like orange or lemon, use the preparations of amla in the form of amla churn or amla chutney or amla murabba or amla made chawanprash. This
Any
time
other
I think
ingredients that
amla
we
is
could
the
use,
first thing
doctor,
which
on a quick note?
one should. Yes, for building immunity, one resin, you know, we all have resin in our kitchens. So 4 pieces of resin you soak in the water and have in the evening, and evening again you soak in the water 4 pieces and have in the morning.
Okay, raisins,
and
dry
turmeric
grapes,
milk.
that's
Again,
a great
the kitchen
remedy.
item, but very good in present scenario. So this is 1/4 teaspoon of turmeric. The turmeric, same turmeric we use in making cooking. So 1/4 teaspoon of turmeric, 1 cup of milk, 1 cup of water. You boil for 5 minutes, filter it, and have this yellow turmeric milk every night. So it will give you good protection.
Indian meals itself, most of them are cooked with all of these ingredients. So it's great to have healthy home cooked meals. We understand fresh food, well cooked food is what is important. Let's quickly go over to our Ayurvedic specialist from Bangalore there, Dr. Samarth. We do know that this is a time where you need to build your immunity, boost it with some superfoods. Do you have a trick or two up your sleeve there?
Good morning, Nabila. What I would like to emphasize is there are a lot of things that people are talking about what to consume. I will focus more on what not to take, because in this season there is always a chance of symptoms like flu and cough and such other things. So to prevent all this, I would advise viewers to eat in moderation, to eat less and eat foods that are easily digestible. The reason is because when you tax the body with foods that are heavy to digest, what it does is it puts the body into a situation where it has to also deal with this virus and also deal with all the heavy foods that you eat.
Very true.
Try to avoid curds, try to avoid sugar related beverages, try to avoid foods that are like urad dal, excess in urad dal, and too much of fruits, too much of cold things. These are the prerequisites. And once, if this virus comes through into a person, their initial signs and symptoms needs to be managed very well. First thing is, of course, follow WHO guidelines going into isolation. But first thing is to eat in moderation. Don't overeat yourself. Don't do too many things. First thing is contact a health professional, a registered Ayurvedic practitioner or a registered medical practitioner or any other system. So eat in moderation is one thing, and there are a lot of other things you can do. Is simply sip hot water, especially ginger, which is called Vishwa Bheshaja in Ayurveda, is a universal medicine. We have a lot of anecdotal evidences in our classical textbooks where India has gone through many pandemic situations like this.
So warm water it is. What else do we have,
Ayurveda Vaidyas have dealt it centuries ago.
Dr. Samat, let me put you on hold. Let's quickly go over to Gopakumar there, who's our experts, the RMO from Government Ayurveda College in Kerala.
Okay, the first thing is there is no need of much panic, and the only thing what we have to do is we should be a little bit more responsible as a citizen. Then only we can be safe and the society can be safe. Okay, coming to the Ayurveda, we always believe in the concept that we have to empower the immunity, because the microorganisms like virus, bacteria, they will always make their entry through different gates of time period. So the ultimate protection is immunity. We have a terminology called Rasayana, which is very much popularized. There are so many modern research studies telling the immunomodulatory activities of the Rasayana. The word Rasayana means which will empower our immune system. You can always take Dashamul Rasayana, Indugandha Grida, Agastya Rasayana, such medicines only after the advice from a qualified Ayurvedic medical doctor.
If you have a word about what to do at home, ingredients used from home, Dr. Gopa, would you know?
These are the two drugs, Ishti Madhu and Ashwagandha. These are the very common drugs available and they are very much suitable to empower the immunity. The fourth thing is people are very much stressed. We very well know when there is chronic stress, that will also negatively affect the immune system. And the important thing is the environmental health. We have to do something for the society, for the environment. We have to make the environment free from the microorganisms. So Ayurveda suggests certain dhubana, means fumigation using the medicated powder. There is a yoga called Abarajida powder, which is available in classical Ayurvedic pharmacy, which you can buy and do fumigation in your house premises. This house premises and offices where you work, you can use this
these are your
fumigation.
opinions out of your expertise there that you all are listing out. Let's quickly go over to Deanne. Deanne, we do know that several rumors about how a particular diet can really benefit during this time of coronavirus, like keto diet, like intermittent fasting. Do you think diets as such will really help you wade through this crisis?
So I come from a school where we don't believe in diets. If we are Indian, we need to eat locally. We need to eat what we grow. We need to eat from our farmers close by, because we need to encourage our farmers. And exotic fruit and vegetables do not work for us. We need to eat, like for example, papaya is very high in vitamin C. So this is the time to eat papaya. Guavas. You know, whatever's high in vitamin C, it's better to get it from our fruit
catch
source
a cough and cold with
than
guava.
from a supplement. I don't know, you know, whatever, because it's a local fruit, and eating locally is what should be done. What should be done. So eating locally, eating what is grown here, eating what our grandparents did, you know, they ground our masalas fresh. Anything in a packet,
Dr. Lavneet, fresh foods, any diets that would cater to fighting this crisis? We know that keto is largely followed. Many women love the diet, but here at a time like this, is it advised?
I think this is the time that we need to get back to balance and appreciate balance for the power it has. And most of the diets, so-called healthy diets, are mostly extreme in nature. And this time when you are trying to strengthen your body, it cannot come with something extreme. So like we are saying that don't panic. Even in the kitchen, when you are looking at your food, it has to be freshly prepared. And like earlier discussed, it has to be something that is easy to digest so that your body can take rest. Now, if I had to talk about food groups that can help you build immunity and strengthen, that would be dals. Why? Because be it dal, chana, rajma, they are full of zinc, magnesium, selenium and nuts. These two families, if you include in your diet, we are talking about vitamin C, which is great. We know we get it from citrus, but you do need certain minerals to boost your immunity as well. And which you will get from dal family, which you will get from nuts and seed family. So try to have 3 servings of dal and 2 servings of nuts and seeds. It could be almonds, which rich in vitamin E, which is again a big immunity booster. Another thing which we are ignoring is vitamin D deficiency, which most of the Indians are facing these days. And vitamin D plays a very important role in boosting your immunity. So if you know you are deficient, please make sure you have a supplement, because it's not easily available through food. Don't have raw food during this time, even though fruits and vegetables do help in building immunity. But at the time when the viral load in your environment is high, you want to make sure that your food is nicely cooked and then you have it.
Absolutely. Thank you very much, Doctor. We do know that this is an important piece of information because people are now staying at home, letting go of their work. Of course, they're working from home. Their comfort of their couch on a regular basis, a prolonged period, not hitting the gym can really make you lethargic. So these are ways to really have a balanced diet, stay fit, so that you jump back to action, being healthier. All right, quickly going back to Dr. Samarth. Dr. Samarth, we do know that this is a time where you have an itchy throat and want to cough every now and then. I'm facing similar situations, and you just don't know if it could be coronavirus itself. And at a time like this, when the season is of a flu, what do you really do? Home remedies, please.
See, in this situation, when you're down with a cough and cold, I would say first isolate yourself. Isolate yourself from your family members and especially old people in the house and children. And once you isolate, first thing you have to do is don't overdo things, don't overeat things. Ayurveda is of a concept called ama.
You got to keep your diet limited, yes.
Because the body is into a mode of fighting the infection. So eat less. Try to skip a breakfast, but have a very moderate lunch and a dinner. Like in India, you can have khichdi in North India, you can have rasam rice in South India. So you try to eat very easily digestible foods with a lot of ginger, pepper in it. So what this does is it equips the body to fight this infection to a certain level, so that once the infection aggravates, technically after the 6th or 8th day, so there is no much stress on the lungs. See, usually what happens is with COVID-19, it has various stages. In Ayurveda, generally starting with Jwara, it might lead to Kasa, Shwasa and Kshaya. So at each of these stages, a good registered Ayurvedic practitioner can help. What I would really like to stress here is that India is a very crowded place. It's a developing country. There are a lot less modern doctors and infrastructure here. So when this problem is going to hit our country in maybe 2 weeks' time, or maybe probably there is community transmission, we're going to have an overwhelming burden on our health system. So you can see everybody is talking about reducing the curve, for broadening the curve.
Flattening the curve.
Ayush doctors play a very key important role, where Ayurveda can help in 3 ways. One is manage mild symptoms of this problem. Second thing is Ayurveda can help in managing secondary problems. Third thing is Ayurveda can help prevent patients going into critical care.
Let's quickly go over to Dr. Parmesh. Dr. Parmesh, would you tell us morning, afternoon, evening, a few simple foods or meals that we can adopt and eat in a regular Indian household to ensure that we are fit through the day?
See, the first thing, as everybody is telling, that have balanced diet. And in diet, you have to see 5 parameters. First, the quality of food should be very natural. Second, the quantity of food should be whatever we are eating, we should never overeat. And number 3, combinations are very important. There are certain combinations, there are certain food items
like,
which we
could you give us a quick example?
So we have to take care of that combinations also. Yeah, just like you don't have non-vegetarian food with the milk or ghee with honey or sometimes citrus with milk. So these combinations are not good at all for the body. And then timing of food is very, very important. So eat at times, proper times. Have breakfast at times, lunch in time, and dinner at fixed time. And then way of eating. Way of eating is also very important. These are the points which we have, forgotten, that we always give emphasis on the quality of food. But we should also be concerned for the quantity of food, combination of food, timing of eating, and way of eating.
Right. So eat what you're eating, eat healthy, eat fresh, eat limited, and use all your household ingredients. Your Indian ingredients, spices is possibly the best way that you can.
Slow eaters should be appreciated. Slow eaters should be appreciated this
time. You gave me a very interesting point. Those who eat water and drink food will never fall ill. That's a great advice there, doctor. Let's quickly come to Diane as we wrap.
Yes,
Diane,
it's a general saying and very, very, it's very scientific.
Right, we got it. Diane, quickly, we're waiting to see your asanas that you have prescribed to your followers. We do know that you've also advised several celebrities who are currently working out at home. What do you have for us?
Firstly, meditation. This is the time to meditate, a lot of breath work. Whether it's alternate breathing, whether it's breathing in, holding your breath and breathing out, whether it's the fire breath, whatever, all your breathing techniques, this is the time to breathe, because we live in polluted cities, we're inhaling pollution, we don't breathe well, we don't breathe fully into our lungs and out, so this is the time to concentrate on breath work, because we need to calm down, we need to... besides the yoga thing, a lot of all the yoga asanas, to practice yoga, whether it's Iyengar, Ashtanga, Vinyasa, Hatha, flow, whatever suits you, to practice, self-practice yoga at home, this is the time. Another thing that I want to say is about sleep. Since you're homebound right now, this is the time to practice taking naps. Taking a nap in the afternoon, like what our grandparents did, it's really important to take a nap.
Yeah, I hope it doesn't become a habit.
Out.
It's going to be difficult to get back to work after that.
Yes. No.
Right.
No. But even if you're at work, it's just good to get some silent place, and even if you're sitting up and taking a little mini 10-minute nap.
Absolutely. There's no doubt that this is the opportunity that we finally get to at least get back to a healthy lifestyle. Quickly, I'll wrap with Lovneet. Dr. Lovneet, any quick changes that we could make?
Like Diane rightly said, that sleep is such an important part of our well-being. So sleep at least for 7 hours. This is our opportunity to reboot our health. And if you're a smoker, don't smoke, because it directly influences, impacts your immunity negatively. Yes, and eat in balance, and eat home-cooked food, be kind, and stay with loved ones.
Dr. Parmeshwar, thank you very much. Thank you, Diane. Thank you, Lovneet, Samarth, as well as Dr. Gopal. This is really important information that our viewers have been waiting for, and it's about time that we use this opportunity to really rethink about the lifestyle that we have adopted. Now, the crisis is real, and so is our habit. At a time like this, we can certainly pledge to adopt healthy lifestyle practices, isn't it? Well, if you really want to emerge from this crisis, then you've got to rethink your choices now. Thank you so much for watching. Stay healthy.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.